Dr. Gauri Agarwal, I of course begin by asking you, ma'am, if you could just explain to our viewers, you were discussing a case study earlier about male infertility. What happens is that even in today's day and age, a lot of the blame for not being able to conceive a child or have a child is placed on women. Discussions about male infertility are pretty much nil, not too many. So if you could first, ma'am, just begin by shedding some light on the same.
Hi, I would like to do a small case study on a real patient I had in my OPD. So I'll just stand up and just do that.
Yes, for sure.
So I would like to start with something. क्या मेरा वंश आगे नहीं बढ़ेगा? क्या मेरे आंगन में किलकारियाँ नहीं गूंजेंगी? क्या मेरा अपना बच्चा कभी नहीं हो पाएगा? And these are very typical questions which come to my OPD daily. So ladies and gentlemen, I'm Dr. Gauri Agarwal. I'm an IVF and infertility specialist. So I would like to start with a small case study of a beautiful, small, cute couple coming to my OPD from Dadri as I sit in Ghaziabad. So this couple enters my OPD, and I can't share the real names, but Rahul and Anjali, because I'm a diehard fan of Shah Rukh Khan. So Rahul gets in my OPD with Anjali, and he said, "Ma'am, isko bachcha nahi ho raha hai, zara dekhiye." And that typical tone which comes, but fine, because I'm so used to it. So I started taking their history. They had a thick file of reports, and I started seeing the reports. There were multiple reports of gynecologists, of ultrasounds, blood tests, genetic reports, but all of Anjali. So I just asked Rahul, where are your reports? मैंने कुछ गलत पूछा क्या? He got angry. He said, मेरी reports क्यों चाहिए आपको? I'm absolutely normal. मेरे को proper ejaculation है, मेरा sexual life बिल्कुल normal है, मैं gym करता हूँ, I don't smoke, मैं alcohol नहीं लेता. I mean, there's a sense of denial every time when I ask for a male report. And it happens in my OPD. But my concern is that I have to educate these people. So after 40 minutes of counseling of Rahul, finally he decided to get his sperm test done. So my team showed him the semen collection room, and he was given a dibba कि जाओ sample दे दो. And I started seeing my OPD as usual affair. After 2 hours, I see Rahul outside my OPD. And he was like, "Ma'am, ये report गलत है. ये मेरी report हो ही नहीं सकती है." I made him sit and I made him understand, look, you can have semen, but sometimes that doesn't have sperms, and that's known as azoospermia. There are many reasons for azoospermia today. People, there can be genetic causes, there can be infections, there can be toxins, there can be vibrations. We keep our phone in the pockets, we keep laptops on our laps, and there are so many vibrations. But I think he was in a sense of denial. He said, "Ma'am, ये report गलत है, मैं फिर से check कराऊंगा." And I think that's more important for him to be self-convinced first. So he went. After 1 month, Rahul enters my OPD again, very sad. He said, "Ma'am, आपकी report ठीक थी. मुझे azoospermia है. I have no sperms." मैं क्या बोलूँगा अंजलि को? मैं क्या शक्ल दिखाऊंगा उसको? Please don't tell her that I don't have sperms. क्या मेरा वंश आगे नहीं बढ़ पाएगा? I mean, कोई भी हो, शाहरुख या गब्बर, सबको बच्चा अपना ही चाहिए. So with the latest technology, I explained him that with low sperm count today, you can go ahead with TISA. That is, we put a needle in your testicles and we retrieve the sperms under anesthesia. राहुल तो शिवर करने लगा. कहते हैं मर्द को दर्द नहीं होता. But I mean, Rahul was shivering in just listening to this. But he had no choice, so finally he agreed to go ahead with TISA. So we went ahead with TISA and we retrieved sperms from Rahul's testicles and we froze them. So finally he was happy that we got sperms from his testicular biopsy. He said, "Ma'am, I am so guilty. मैंने अंजलि के इतने टेस्ट करवाए, इतने अल्ट्रासाउंड्स कराए, मैं इतने सालों से घूम रहा था, and I thought सारी गलती अंजलि की है. But अब मुझे समझ में आया है that the problem was with me." So we all know that when females come to our OPD, we make it so comfortable for them. उनके अल्ट्रासाउंड्स होते हैं, we cover them, we make them lie down comfortably. Injections लग रहे होते हैं, we are so careful, doesn't hurt them. But to men, what we say, ये है डिब्बा, ये है semen collection room, go, get your test done. Nobody understands their psychological issues. They have erectile problems, they have ejaculatory problems, and I'm sorry I'm talking so openly about it. But that actually happens. And I think we should spread male infertility awareness, and people who have issues should meet andrologists and urologists. So finally, since we got the sperms, we did IVF for Anjali. We started injections and we made eggs for her. And then we used those frozen sperms to inseminate these eggs. And we made babies. So finally, Rahul had his own embryos. And then we transferred these 2 embryos in Anjali. After 15 days, good news, Anjali was pregnant. Rahul was so happy that despite his no sperms, he had his own genetic baby. So right intervention is so important today in cases of infertility. So while I was doing an ultrasound in my OPD, while checking for the heartbeat, they had twins. Rahul started crying. I mean, he was aiming for 1 child and he had 2 despite no sperm count. The couple went back happily home. After 4 months, Rahul again came to my OPD. I got scared. Kuch hua kya? He said, "Nothing. I wanted to tell you something personally. I have bowed in front of 3 women in my life. Durga Ma, my mother, and he bowed in front of me. And I think this is a real story, and this is something which we all doctors actually work for. We need that respect because this is what we are working today in this society, and a safe place for us. Thank you.
Well, Dr. Gauri, thank you so much for taking us through that case study, a very, very important interjection in our day-long celebration of womanhood, a very important interjection there on male infertility. Once again, a huge round of applause for Dr. Gauri Agarwal for joining us on this, of course, the Delhi edition of We Women Want.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.